I'm just curious to find out, since we have such an amazing panel up here, for pediatrics, some of the discussions we've had here before is like, what do we even describe as integrative medicine? But coming from where you are, you know, your experiences, even, you know, treating your own families at home perhaps, what you've treated in elder patients, et cetera, maybe what's a brief definition of what you think integrative medicine is and how you might foresee how we create integrative medicine for children when it's their parents who are actually bringing them in, you know, taking both into consideration. They don't have a voice, they don't know what they need or want yet.
I can start.
Okay.
So, to answer your question, I think specifically in regards to pediatrics, so first of all, I think integrative medicine, the first thing we think of is how can we integrate East and West, or how can we bring in complementary and alternative medical practitioners into the mainstream medical environment. And I think, you know, pediatrics is definitely an area where that's going to be a good thing to do. So I think that's one level of integration. I think, but with pediatrics, another level of integration is actually integrating the family into the treatment. So it's not just treating the child that comes to see you, but it's also speaking to the parents and assessing what's going on in that child's family and their home life. And how can we address that systemically through the whole family? Because a lot of times, like we work in the chronic pain program at Children's Hospital, a lot of these kids will come in with chronic pain problems without any real diagnosis or any, like they've had every lab test and every scan known to man, and there really isn't a problem that we can see, but the child still has headaches every day. And we start to ask them questions, and we might ask, well, when did this start? And we'll get an idea that it started around the time that the parents split up, or that there was some sort of a problem at home. So I think part of what we do at Children's Hospital is we try to integrate care of the entire family into that process. So I think for kids specifically, it's really a matter of seeing the whole family unit as a unit and trying to address that as a whole. So I think integrative medicine really has to do with those two things in my mind, specifically for pediatrics.
If I can speak to that as well, it is about education and educating the parents primarily, because the parents do bring the children in, but once the children start maybe into adolescence, they start asking. This morning, I had a mom come in. I was working on the mom, and she said, "Oh, I know I've got an appointment for Joey scheduled in a couple of weeks, but he had a meltdown doing his homework last night, and he said, when's my next acupuncture appointment? Can you get me in earlier?" So, a 13-year-old boy. So he's in touch enough to know that he responds well to that, and he can manage his hyperactivity better when he gets acupuncture. So I think it's a matter of educating parents, and then at least with acupuncture, and I imagine with many of the other modalities we talk about, the results are so startling that the kids recognize the difference.
One of the issues with the quote Western idea is we always want to find one problem and treat it. And well, that's really good when you're doing cancer chemotherapy, okay? But the thing I appreciate about the traditional Chinese medicine is it's more, instead of treating the problem, you're treating what's the disharmony in the kid that's creating the environment that the problem will then result from. And so I don't think, especially on some of our kids, like I have a kid who just keeps having vocal cord spasm. I think he's got some underlying stress that we don't understand really what's going on. But every treatment we've given him for specific things like reflux or this or that is not beginning to touch what I'm sure there's something underlying it. And so I think that that's my idea. We're good at specific things, but not good at treating the underlying personal condition.
Yeah. Which I think is where the integration really comes in. If we can really address these issues from both sides, and then if we communicate as professionals, I think that child has the best opportunity to really receive good care. And then we start to understand what each other are doing, so the next time I see somebody with a very specific problem, then I might be able to make sure they get the right referral. And a lot of times that's really important to get a timely referral for a kid. Other times it's really important for people to recognize that this is a problem that maybe Chinese medicine would be well suited for. So it's really, it's also like Leslie said, it's educating families, educating kids. It's also educating ourselves as professionals and learning each other's language and getting comfortable with each other. So I think that's part of it too.
Yeah, I mean, I definitely agree with him. It's so important to educate the family as a whole, because it really empowers them about their own bodies. And the more they know about their bodies, the more actions that they'll be able to take. You know, I have I'll share a little story where we're adjusting a family, and we're adjusting the dad and the mom and the son. And about 4 weeks into care, you know, I always do a progress exam, kind of check in, see how everything's going. And I asked the little boy, I said, so what are some of the biggest differences that you see that are changing? And one of the things he said was, Daddy stopped hitting me. Okay, so that's why it's so important that you guys make sure you take care of the whole family, because you never know how it can impact not only that person, but the whole family and their dynamics and how they grow up, basically. So really educate, and you know, I mean, I love what everyone here is saying, is really being able to refer, you know, and see, you know what, you may need some acupuncture, so, you know, to send to someone there. But that's the biggest thing, is just really educate to empower the families.
Walk around. Go ahead, Denny.